Yeah, thanks so much, Pippa. Appreciate you. And hi, everyone. I'm so glad that we're all able to be here today. And a special thank you to Vicki Harrison and Rob Morris for joining us for this session. So today we're going to be talking about interventions to address the impact of social media on mental health. And we're going to be hearing from Vicki Harrison, and she's the author of Social Media and Youth Mental Health and the co-founder of the Good for Media peer mentoring program at Stanford, and also Dr. Rob Morris, who's the co-founder and CEO of Coco, which we're going to learn more about today, but is a platform that provides free digital mental health support on social platforms. So I'd like to give them the opportunity to really introduce themselves and talk more about their work. So I think we'll start there, but I'd like to just encourage everyone to be part of this interactive discussion. So rather than save Q&A for the end, we'd like to encourage questions throughout. So feel free to send your questions in the chat. I'll be moderating the chat, and we'll then find a time to bring them to our panelists. So with that, I would love to invite both Vicki and Rob to introduce yourself, and also to share a bit about us, the story of how you came to work in the social media space, what motivated you towards this work, and also to share a bit about what you've been doing. And I know you both have such wonderful contributions. So Vicki, if it's all right with you, maybe we can start with you.
Sure. Thank you so much. And thanks everyone. It's great to be here. So like they said, I'm Vicki Harrison. I'm a program director here at the Center for Youth Mental Health and Wellbeing, which is part of the Stanford Psychiatry Department. I just had my 10-year anniversary here, so I've been here for that long. And our center, we develop a range of programs for young people in the 12 to 25 age range, and we focus on early intervention, increasing equity and access to mental health support, and we center youth voice. So a lot of our work is co-designed with young people directly. And the range of topics we have is school mental health, native youth mental health, early psychosis, adolescent screening programs, our one-stop shop integrated care model called Alcove. We do a lot of suicide prevention and work in media and mental health, which is where this topic is centered. One of our early projects in our center was actually developing this tech hub. So it's wonderful to see how it's blossomed, and we sort of stepped away to work on some of our other work, but it's great to see how you all are building it out, and I'm grateful to be back. And around the same time that we really kind of transitioned away from this tech hub, I think around like 2017, 2018, I was really talking with a lot of our youth advisors who were informing our other youth work. And I started asking them questions about social media and media in their lives, and was really kind of struck by the responses I was hearing from them, and how it was really changing their lives, and also a bit of a powerlessness that I was hearing just about how they really felt they needed to use the platforms in certain ways, but they were really struggling with some of the sort of the side effects or byproducts of how these platforms were designed. So really started digging into that and paying more attention to it, and trying to get some projects started to really support young people with their mental health as technology was evolving. And one of the big projects that we were able to get off the ground with a couple of young people is our Good for Media project. And I'll put it in the chat for people that want to get a sense of what it is. But really, it was designed to kind of harness that wisdom that the young people had about how their daily experiences were for them, and amplify that for other young people so it could be of support. And also, their voices have been really influential in sort of some of the discussions that have been happening at a policy level recently. They've been invited to some pretty big spaces with the White House, with state legislature, to talk about their thoughts on some of the policies and decisions that are being made. So, but really the thrust of the program was for peers to support each other. And so we've done a lot of work in that area. So I'll just stop there with my intro, and happy to discuss more.
Great. Thanks so much, Vicky. Yeah, that we'll be excited to hear in more detail about those things today. And Rob, how about you?
Well, hello everybody. I'm so glad to be here. I am co-founder and CEO of Coco, and we provide free digital mental health interventions to millions of young people globally online. We've served around 4 million people in over 190 countries, so very global. And part of the reason for that is we are embedded within social platforms and we can basically exploit some of their scale to reach as many people as we can. Our general philosophy is that to help make a population level impact on youth mental health, we have to reach young people where they are. And a lot of the time, up to 9 hours a day for some people. They're on Snapchat, they're on Discord, they're on TikTok. We're looking to a future where they're talking to AI companions, wherever their eyeballs are, can we bring tools and interventions to them that are privacy first, free, and accessible? So I've spent most of my career building within that model, but the story of how myself and our team got involved with social media, I remember it as a particular day. So when Coco first launched, we were an iOS app. So this is like 12 years ago. The whole concept of digital mental health was very new, and people got their services through the App Store to help refine our service and our products. We would do a lot of user interviews, and out of convenience, sometimes I would just go onto Twitter or some other platforms you probably don't remember, things like Whisper and Secret and Yik Yak. I don't know if anyone remembers Yik Yak. But I'd go on there and I would just search different strings. So I might search "I'm depressed," and then I'd find people on those platforms publicly disclosing that, and I would reach out to them and have a conversation and kind of understand their needs. And through that, I even saw people, disclosing on these platforms like, I want to cut myself or I want to hurt myself. And I would search those terms as well. And I remember very distinctly one day doing that on Twitter and seeing almost every 5 minutes a different person disclosing that in a self-harm context. And for us, there was a revelation that was one, if we want to have the most impact we can, we might want to bring our services directly to these platforms, for instance, in direct messaging channels or really any way we can, rather than kind of have to get them to go to an app store, find us, download stuff. And then secondly, we were astonished by how much dangerous content was living and viewable on those platforms at the time. So we wanted to build models. Back then, they were called machine learning models, not AI, to find that content and help remove it. So today, Coco kind of mixes those. For some platforms, we help them find dangerous content. And so if someone is looking for that content, we can redirect them to a WhatsApp intervention or something on Discord where they can engage with our chat bot, which will triage them to helplines or some single session interventions that we run on our platform.
Mhm. Yeah. Well, thank you so much for those intros to both of you. And if folks have more specific questions about what Rob and Vicky are working on, feel free to put those questions in the chat. But just to sort of start here today, I wanted to maybe set the stage by hearing a little bit from both of you about your views on the conversation about the benefits or the harms of social media and how to kind of weigh those. There certainly are a lot of voices and speaking to the risks and harms of social media. And we've seen that even become a more political discussion in the last couple of years. And there are also folks who are sort of speaking to the fact that sort of a focus on social media as the cause of problems in youth mental health or the youth mental health crisis risks ignoring other pieces of the puzzle that are also important to sort of pay attention to. And so there's a lot of voices on both sides. And I'm just curious to hear both of you talk a little bit about your views on how we should think about the benefits and harms of social media.
Sure, I can go ahead and start. Yeah, I mean, I appreciate the question. It's a complicated question, despite what the media narratives are around it, and I think that that's hard for those of us who kind of work in this area. And I think you mentioned in my title that I was involved in putting a book together on this topic of youth mental health and social media. And part of that was really trying to like zoom out from this topic of like it's very cause and effect, the way that it's often talked about, like using social media harms mental health. And it's like it's the evidence really isn't there for that, which is what a lot of the research will show you. Because it's pretty complicated. There's so much more to the way that people engage with social media. It's not just like a cause and effect. And so this project that was published last fall, it had 12 different chapters, 40 different authors from around the world looking at the many facets of social media in young people's lives. And pretty much every chapter will have pros and cons. Like it's really a double-edged sword in many, many ways. And that's just the reality. And that's not a easy soundbite or easy thing to solve from a policy perspective. So it's pretty complicated. And I think, most people recognize the benefits. We all, use it for the same reasons that young people would use it, which is connection, education, economic opportunity, identity development is pretty big for young people on social media, entertainment, support, joy. But there are a lot of harms that people are exposed to as well, just in terms of content. Rob was mentioning what's just sort of on platform, and it varies platform to platform. Young people, really do struggle with the comparative aspect, social comparison, the beauty standards. I mean, it's a visual medium. So by definition, like it's just very much based on image and beauty. And that's hard for adolescents, especially. And then, of course, everyone has a lot of concern about the biggest harms of like suicide, self-harm, content eating disorder, child sexual abuse material, but even mis and disinformation. I mean, there's a chapter on that because I think that comes with its own potential harms, whether it's health harms, political harms. And then you hear a lot about the attention economy and the addictive properties of algorithms. And I think that's a whole Hubinar in itself, whether or not social media is truly addictive. I think some people think so, some people disagree, and I think there's a lot of room for debate and research on that. But what I always come back to is, despite what the research is saying, I talk to young people and like we're trying to hear from them because studies take a while sometimes, but their daily lived experiences are telling us there's certain things they really love, there's certain things that they don't love, and they're struggling in some ways and thriving in other ways. And so we do have information to go on that's not necessarily research. And so I would just say, there are things we can do despite this big question not having a solid answer.
Mm-hmm. And Vic, if I could just ask a follow-up question, what's your experience with seeing how this discussion around benefits and harms plays out on like a policy level?
Well, I mean, I think we're seeing a lot of that with the move towards bans, being proposed and age gating social media because I think the harms are really hard to solve for, and so I think people feel the pressure to do something, and so they feel like if we can't get our hands around it, we have to just block access. Which, I think we have concerns about that having some side effects as well, like not necessarily going to have the intended outcome. So I think that's what I'm seeing right now is that people are sort of quick to do a ban because they can't solve it in another way.
Mm-hmm. Mm-hmm. Yeah. And Rob, would love to hear you weigh in on that too.
Yeah, I agree with all those points. I think another thing that makes this debate so confounding and frustrating sometimes is it's not just the complexity of how people use these services and for in good ways and maybe less good ways, but Also, how we even define social media can really frustrate me because I've seen, in the same conversation, someone talking about a WhatsApp chat group amongst close friends versus scrolling passively and consuming content on Twitter, or TikTok, for hours a day. So social media is this really catch-all term. There's definitional chaos all over the place. So it makes it hard to understand how to talk about it reasonably and thoughtfully. And, young people are the fastest demographic to pick up new platforms and exploit and use them to communicate. And so where they are and what they're experiencing changes far faster than us in the research community can really keep up with it sometimes. So that's one element. The other thing I would say is I agree there, like, it's really hard to run rigorous studies on this and draw, cause arrows between things. And yet at the same time, in my work, I can see absolutely devastating content on there that, maybe not in aggregate is making a difference and you know, merits the kind of public discussion, but it's just, terrible to see sub-communities sharing pro-anorexia videos or young people sharing videos of themselves harming themselves. So that's a struggle. And then the last thing is I do think there's a huge opportunity to better instrument these platforms to help people. And that is not widely discussed. And yet we have tools and we have data showing that it works. And I think that should be discussed and prioritized more than, really black and white arguments around whether we should ban these things completely or not, which is impractical and inadvisable.
Mm-hmm. Uh, and I'm seeing a comment from Peter in the chat. Peter, if you want to come off mute and share a little bit about your comment and your question, feel free.
Sure. Hi. I'm confused. So the research shows that it could be harmful or not, and how does it help? I mean, yeah, I'm honestly confused. So you did the research, great. You found some pro and cons, wonderful. But what's the bottom line? How I, from how I understand it, the bottom line is could be harmful, could be not, could be useful, could be not. Um, so, I mean, correct me if I'm wrong, but I'm just, we're not better off after the research than before.
I mean, I would say I think it depends, what research you're looking at. I think like if you look at the National Academy's report that came out in December of 2023, they kind of looked at a bunch of research that's out there and they go into detail about some of like the benefits and the harm. So I think they just said that they can't come to a conclusion as to like, is this bad for mental health overall, which is just a big conclusion to draw anyways. So I think that it's also very personalized how people use media and like the circumstances that they have, like their baseline health or mental health, as well as, the context that they live in, the support they have. So it's very nuanced and individualized. And that's why I think it's hard to draw like, general conclusions that are helpful. But I think you can dig into the research and see a lot more detail. There is definitely more detail available.
Question. I've heard some suggestions that, for example, social media shouldn't be anonymous because if people are hiding behind the avatars or behind some screen names, it's it's very easy to do if it's your name. It's much harder to offend somebody because it's actually everybody knows who you are. So is here anything about that part of it?
So
That's
actually, I
part of
think
a
that might be a good transition into another question here, talking more about like some on-platform interventions that have been proposed, and I think it would be really wonderful to hear from both of you if you can share about any sort of specific on-platform interventions that you've worked on or know of. And in particular, thinking about, as we've talked about, Rob, you mentioned sort of the reach and scale and how we can leverage that um, to distribute tools more broadly, especially to folks for whom that might not be as accessible. So yeah, would love to hear. Maybe we can start with you, Rob, on any specific on-platform interventions that you think are particularly helpful.
Yeah, I will dive into one, but happy to talk about others, including that comment around anonymity. I think that is another case where it really depends on the platform and the context. And there's certainly many cases where disclosing actual personal information would not be ideal for young people in particular. But for Cocoa, one thing we observed with the platforms, and we've worked with most of the trust and safety teams there, is the standard for most of them is if you search for suicide, self-harm, or even pro-anorexia content, they will put a banner up there and they will provide resources to, for instance, lifelines and a few other things. And we provided these in our own products as well. And we asked users, about 5 hours later, whether they actually use those services. So, assuming we have good signal and they're showing imminent signs of risk, which we were able to determine as best we could, our goal is to try and increase conversion to those services. And we found that the majority of young people, even when these things were presented right on the platforms they use, they were not utilizing them. And we asked, why not? And a lot of objections and misconceptions were raised, including things like, I don't want an ambulance to show up at my house if I contact crisis text line. I don't want my parents to find out. I don't want to talk to a doctor. And tragically, I saw some that were like, I just want to talk to someone. So young people don't have that context. And so for us, this felt like a huge opportunity. If you think of all the millions of people who are exposed to these PSA banners, there's no evidence based approach for how to build these things, how to do that handoff. And yet these platforms spend billions and billions of dollars optimizing ways to get you to click into Amazon and buy, some product. So we did a lot of work on that. We were Harvard and then Stony Brook on this to try and optimize how can we get young people to make use of these services, not just lifelines, but other services as well. What should we present? How does that work? And we came up with a lot of user experience flows that showed really nice improvements in uptake for accessing all sorts of different services. So there's all these like touch points in a user's journey on these platforms that are neglected. The platforms have no incentive to devote resources to refining them as they would for every other touch point and surface area of their platform. So that's an exciting on-platform opportunity. There's so many others, but I thought I would focus on that one specifically.
Mm-hmm. And curious, what types of changes did you find could increase engagement with the banners?
Yeah, we did a couple things. One was given the misconceptions and objections that came up, we provided a simple flow that said, are you likely to use this? Yes or no. And if people said no, we said that's understandable. Here are some concerns that commonly come up, and they can leave at that point, or they can click through and see like, I don't want the police to show up, or all those, and kind of learn and then be prompted. We also looked at the fact that, people showing some signs of risk, we can't really definitively know what that risk level is. in this setting, and we looked at providing just a broader suite of tools. So a helpline is not, going to be appropriate for everyone, and you're really underserving people by providing that exclusively. So we looked at resource uptake when we provided, an online safety plan or access to single session interventions. And we looked at even hopelessness scores before and after they experienced these flows.
Wow, that's wonderful. And Vicky, if you could also share with us some specific on-platform interventions that you've been part of.
Yeah, I think, the work that we've done with Good for Media and the young people are not specific to one platform. So I think they're a little bit broader, but I think what I would share is that, um, they are welcoming age appropriate design. And like, I think that there's a perception maybe that they wouldn't want any sort of like friction points or barriers to like open access to whatever they can do. But the young people are actually wanting some structure and friction. They want a safe experience online. So, some of the things that they called for in the listening session that they participated in with the Biden-Harris administration earlier last year, was, making privacy protections the default for young people on a platform, reducing features that or removing features that would encourage excessive use. And they like having, something, an end point, like to end the scroll, limiting likes or comparative quantifying features, and then having it be age appropriate, which of course enters into the conversation about age verification, which is fraught and not easily solved yet. But I think that's what they would like to see, is to have age appropriate content, age appropriate ads or no ads if possible. So those are some of the things that they have called for and that they'd like to see, and that they appreciate when some platforms do roll these features out.
Mm-hmm. Mm-hmm. And I'm curious to hear, Vicky, what you found in terms of how peers can support each other.
Yeah, that's, our platform is open currently on Good for Media to young people who want to submit a video or a quote or a blog, just sharing their own ideas or experiences about social media, good or bad. And a lot of the workshops that we do in community and in schools, it's really just holding space for young people to talk about their experiences on social media, which we don't have a lot of those. They don't have a lot of opportunity to really talk about, oh, this is sort of frustrating, or I wish that I knew how to sort this out, or my friend is blocking me on this app. And so there's just a lot of like relationship dynamics, interpersonal things that can really weigh on them. And so just having space to like be validated and be like, yeah, that's hard, that's frustrating. Here's what I've done. Here's what I wish I had done differently when I like first got on this app, or I stopped using this app for this reason. So it's just, pooling that peer wisdom and supporting each other, because they could be off platform, but they see benefits. So they want to keep using the technology, and they just don't want it to not work for them.
Mm-hmm. Mm-hmm. Yeah, that makes sense. And right now, you're finding that most of that peer-to-peer support is happening in off-platform type of channels rather than directly form. Yeah, I
I
understand.
think that's a big reason why people do engage with social media, is because of the support that they get on platforms. So yeah, just we aren't doing a lot of that in a platform setting. But I think that's what people like about social media.
We've had a question come up in the chat, and this is from Benjamin Miller. How did you work with the social media companies to get inside to leverage their data to help those in need? In my experience, these companies are not likely to want anyone on the inside or to share data, even if it's for good. And I think that was a question for Rob.
Yeah, good question. It's not easy. We've done as much as we can to refine our service so that they're never sending us any data. We send them like regular expression classifiers, et cetera, to run. And when we audit some of these platforms, we do so in a way that anyone here or even any journalist could, where we have lists of all sorts of terms and phrases and algo speak, as we would call it, new slang that's always evolving, and we look to see the prevalence rate at which these are appearing without any kind of suppression or detection. So we never get social media data, at least in this phase of our organization. Years ago, we did more content moderation across many different verticals, and we were more integrated in that way. But yeah, our preference is to not touch any of that data.
This relates to another question. Um, some on-platform interventions are geared toward reducing time on platforms, like, for example, screen time notifications. And I'd love to hear your perspectives on interventions that may have a friction with the business model of social media companies, uh, which are namely optimized for engagement, and how to kind of navigate that friction in introducing interventions that may help provide some level of protection, but may run counter to business models.
I'm happy to jump into that. We don't advise on time restrictions or anything like that. So I'd be very curious to hear, Vicky, your perspective on this and like the success or, kind of the effects of that. Our focus is on the dangerous content that appears and removing that. I've never had signal from the platforms that a failure to do so is because it diminishes engagement. I think the failure is around the broader business model and how these organizations are structured. So the teams that are responsible for mental health content moderation sit within a trust and safety organization. And those organizations are also responsible for fraud. They're also often responsible for child sex abuse material. And when you're looking at allocating budget in these groups, mental health is often the last in line because they're not legally obligated and they're not losing millions and millions of dollars. And then the tragedy is even when the executives get called in front of Congress and have to turn and face parents who have pretty reasonable, um, you know, uh, accusations that their platform contributed to a personal tragedy, the shareholder value doesn't change at all. So there's not a mechanism within these platforms to value trust and safety. Mental health is often the lowest rung in trust and safety, and we're seeing increasingly trust and safety budgets getting cut and less of a focus, unfortunately.
Yeah, Vicky, curious to hear your thoughts as well.
Yeah, I can actually share some quotes from young people really quick, which would be easier than me just paraphrasing them. So these were some quotes from a presentation that our young people did to a huge room of stakeholders and policymakers. And we asked sort of a similar question about like what settings do they wish existed? And a lot of them were like these very specific, like time-focused or editing type of features. So letting someone know when a photo was edited, a block button to mute people who keep showing up. They love the time check tools that pop up and notify you when you've been scrolling too long. This was just a plug for the creativity and small business opportunities on platforms, wanting a blocker so you could override. You can't override a passcode because they would find that even if they set up a password, they would just like, still like snooze basically, and they want to be able to override that. Hiding the For You page. So like very specific examples of things. And then we also asked them what their favorite apps and least favorite apps were at the moment. For least favorite, you'll see that a lot of why they were saying they were the least favorite is because they waste time on it. Snapchat, they didn't want to have to keep posing for photos. This has no control features. So I just wanted to like quickly share some of their thoughts because I think that it's very, practical solutions. And like I said before, they welcome friction. They want that structure and support. They want a platform that is well designed and has, privacy settings, is going to respond if there's an issue, which does not happen very often. If they report something, they would like that. They want somebody that's looking out for them and where they can have a positive experience.
Yeah. Yeah, that's great to see some of those direct quotes and perspectives of those that are really on the platform. And we have a question in the chat asking to add this question about mandated report for mandated reporters. How do you work with youth on platforms if you see I think, red flag, but we have no idea where they live? So speaking to some of the limitations of identifying an at-risk person on social media, but how do you reach that person? Yeah.
Yeah, my understanding is for most platforms, pretty much all I can think of, if content is flagged, either algorithmically or through another user flagging it, and then reviewed by a team, it can get escalated to trust and safety, and the teams will try and get that person to a lifeline. And maybe a few rare exceptions I recall, but mostly then they kind of shuffle off the responsibility to the lifeline. And if it's a local one that does have the ability to do an active rescue and determine location, they can do that. But again, social media is global, and for people outside of Western countries, that capability is not going to be there.
Yeah. Vicky, anything you'd like to add with that?
No, I don't have a better answer than that. I think that's my understanding as well.
Okay. And so we have another question from Shannon. What would it take to get trust and safety regarding mental health to become a higher priority and more resourced on platforms?
That's a good question. I've been trying to figure that out for a decade. I'm not sure. I think if there was a legal obligation or if they were getting sued in a way that was meaningful, those are two levers. I do know um, sometimes press can be a factor. Groups like Common Sense Media have had some success pointing out instances and buttoning things up. But, unfortunately, I have to be a little cynical about all this because there will be PR crises and then statements from executive leadership, and then just the mechanics of these businesses, and they are businesses, is such that over time, optimizing for engagement and profit tends to erode whether they're like proactive tools they may develop in those kind of high profile public or brand risk scenarios. So I don't know.
Yeah,
We have to be really creative to make an impact. Some platforms, we don't work with them directly. We work with the sub communities within those platforms. It's a whole very difficult challenge.
yeah. I mean, it's a pretty core question, that a lot of people are trying to push right now for this to happen, and that's why I think you have a lot of policies and regulations being proposed. They're just some of them are passing, but a lot of them are getting blocked in court. I think, one saving grace is that there's more passing overseas, and the platforms are having to still conform to those laws because they are passing more regulation. So they're kind of making some changes as a result of that. But again, the business model is to serve, dollars, not health and safety, unfortunately. And I think that's where some of the youth voice is important. And we really try to elevate young people's experiences and what they're asking for. And, we do have a quote unquote youth mental health crisis in the United States that a lot of people are concerned about, including the Surgeon General. So we should be centering that when we're building products, but that's not happening right now. I'll put in the chat that there's another youth advocacy group called Design It For Us, which just put out a declaration of digital rights that they are calling for young people. And if you look at them, you'll see that they're, pretty basic rights, like the right to privacy, the right to delete, the right to transparency, the right to be protected from manipulation, a seat at the table. So just, basic human rights is what we're talking about. And I think that if we were building products from that type of place where you're leading with safety and privacy and the best interests of the young person or the user at heart, you would have a much different product. And I think that that's what a lot of people are calling for. And that's not the current structure, unfortunately.
Mm-hmm. Yeah, and I think that's a good point too, that while it doesn't seem to be the structure or current motivation to build platforms from that design perspective, that really holds safety and mental health and well-being at its core, that people do seem to be now turning to kind of off-platform interventions to try to steer the ship. And I think, we've been hearing recently about some policy changes, including a potential proposed ban on TikTok, limiting phones in schools, ways that like different stakeholders are trying to figure out how to manage this program. And just curious to hear about any off-platform interventions that you think would be helpful in supporting youth mental health or other stakeholders, even like parents, for example. Maybe we could start with you, Vicki.
Yeah, I think the school cell phone bans, I think that there is reason to support minimizing distractions in schools. And so I think that there's definitely some positive steps happening there. I think, again, like we were saying earlier, outright bans without thinking it through can sometimes cause unintended harm. But I think that is positive, and I think young people, are looking for non-digital interactive spaces. So we have this, like very like this techno utopian kind of feeling, especially here in Silicon Valley, that digital solutions are premium and better than others, and that's not necessarily the case. They're one of many spaces where young people want to interact. So I think there's some positivity there. I think that, the project we have with Good for Media and just like letting people support one another I would consider an off-platform interaction, and where we're having just holding conversations. They created a set of conversation starter, 48 different questions to ask each other, ask a parent, ask anyone about youth mental health and engagement with social media. And we piloted those in a space last fall, and they were supposed to rotate after an hour, and they wouldn't rotate because they would just like were so engrossed in their conversation. And again, like they don't get to go deep like this on these things. And so like just having more opportunities for these sort of interactions and connection, I think is really important. And so we need to like, again, hold space for that and not have it all just be in a digital realm.
Mm-hmm, mm-hmm. Yeah, yeah. And Rob, your thoughts?
Well, one thing that we've been exploring is exposing young people to single session interventions online that teach basic mental health first aid and how to support peers. So there's some ways to hopefully in a digital environment empower young people to connect more positively with each other and to help support each other offline in real world. And so I think there's some interesting opportunities there. I think to your comment around banning TikTok and some of these bans in general, it's a tough one. I think for me, I'm more interested in seeing how we can get ahead of the next problem rather than fixing the current one. I just don't have a lot of optimism that there's going to be really foundational change with the networks we have. And by the time we get there, the way young people interact with media might be different. And I feel like whether it's a trend or a fad or a small subset, I do see increasing amounts of users talking about companion AI and companion apps. I wouldn't be surprised in 5 years if many, if not most, young people consider an AI their best friend. And all the implications of that can be really scary, especially when you have organizations and companies that are optimizing engagement and you have an AI companion in that setting. So I would love to see, people getting ahead of the puck, so to speak, and really thinking about how to ensure new platforms as well. Um, have the right guardrails and policies before the business model swallows up every good intention we have.
hmm I think that that makes a lot of sense to think about sort of the evolution of technology and how can we get ahead, and maybe even using the lessons of what we've discovered with social media to inform next steps. It relates to a question in the chat that I missed. I just want to follow up on by Eric Kuhn. What does the research on aggression and TV watching and video games, how does that inform this debate, or what when that was when we were talking about the benefits and harms of social media. Curious if either of you have sort of brief thoughts on that. I think we have time for just maybe one more question.
I mean, I think I know that it's been referenced a lot in terms of kind of the hysteria around that concern, a couple decades ago, and that sort of fizzled out and we didn't end up, banning violent video games, and that we still have a lot of violence in entertainment media. So I don't think that it's seen as a warning signal necessarily, because I feel like it was inconclusive whether there is truly something there. I feel like the research was still mixed. So I think people call to that and say, yeah, it's mixed, just like now today's research is mixed. So I mean, I share some of those concerns, Eric, about the violence that people are exposed to in media. I I still think that there's something there, but I don't think that there's enough data to support big shifts.
Mm-hmm. Mm-hmm. Thanks. Thank you, Vicky. And I think we just, in our last few minutes, Shannon has asked, do you know of anyone who's working on therapeutic warm handoffs on AI platforms in high risk situations versus just telling people to contact a hotline or crisis line? And Rob, you mentioned you're working on that. If you want to say a few words about it, we'd love to hear it.
Yeah, there's nothing I can really share at this point. We have had some partnerships with big language models, but I do feel like they're a little more open to innovating in this way, but it is difficult. But yeah, there are people working on it and thinking about it. It's an interesting opportunity to figure out how to do that.
Um, well, I know we had a goal of ending a bit early to give our panelists who have meetings at 1 some time, but we want to thank you both so much for being with us today. And thank you to everyone else for coming and for all of your great questions.